very much for inviting me to talk to you. It's a great honour, and I wish I was there in person, but unfortunately I can't be. So greetings, and I hope that you're having an enjoyable session. So I've been asked to talk about how to provide effective feedback. And I think it's worthwhile thinking about, first of all, for each of you, what are your experiences of providing feedback? What helped and what hindered? Many of you will have these experiences, and I'm sure that you will have found that certain things have helped and certain things have hindered this process. What I hope to do is to provide you with some ideas about understanding why it might have worked, but particularly how to overcome some of the barriers to giving effective feedback. So why is feedback important? Feedback has one of the most highly rated impacts on teaching and learning. For students to learn, feedback is absolutely essential. The latest studies suggested, that was by Wisniewski in 2021, which is mark number 1, the effect size is 0.48, which is a little bit low. The higher it gets towards 1, the better it is. So it's a bit low. And probably it's because increasingly some of the studies have shown that it's actually ineffective. And that's probably because feedback, people have recognized that it is so important, but it's not given in the most effective way. Some previous studies, such as John Hattie's in 2009, had an effect size of 0.7, which is very high indeed. And that was a synthesis of over 800 meta-analyses on achievement. And if we looked at what does create effective feedback, and that is number 3, which is Hattie and Timperley's seminal paper of the power of feedback. And although it's a few years ago, it's actually a review of previous systematic reviews. What they did is to try and identify what were some of the factors which influenced feedback. And they came up with these high figures, because unless these factors which they found as being particularly effective are included in giving feedback, it is unlikely that you will obtain the maximum benefit and these high levels of impact on performance. So basically what I'm trying to say is that feedback is important. It needs to be done in a particular way if we want the maximum benefit. So this is what I'm going to talk about, is how to get the maximum benefit from giving feedback. What the learner wants from feedback is they need to understand, what are the mistakes? Why did I get it right? Why did I get it wrong? And this is particularly important because often giving feedback, particularly in models where it's very learner-centric, where you say, so how do you think you did? How do you think you can do things differently next time? And what are you going to do next time? The learner may suddenly turn to you and say, well, did I get it right or not? What did I get right? They also need to understand why they made the mistake. And they also need to understand how they can avoid making the mistake next time. And those other 2 aspects, understanding why they made the mistake and how they can avoid making the mistake next time, requires a deeper understanding of what creates an effective performance. Because how can you give feedback if you don't actually understand a performance? So Hattie and Timperley found that there were 4 major factors required for effective feedback. In all of those studies, if you were going to get a high effect size, they found that there were 4 key components. Number 1 is feedback on the task. The learner needs to be, without any doubt, needs to know whether they were of the required standard or not of the required standard. And the reason why that's important is that it's essential for calibration. Because the reason why we're giving feedback is not just that episode that we've actually seen whilst we've been doing a particular task, whether it's reading, a clinical task, doing venipuncture, doing a surgical procedure, examining a patient, listening to a heart, doesn't matter what it is. We're talking of a term called a task. They need to know the extent to which their thoughts of whether they've got it correct or not are equivalent to whether they have achieved the standard or not. Because if there's a discrepancy in what they think they've done right, they are unlikely to make changes in the future. So understanding whether they have got it right or not is absolutely crucial for long-term learning and application. The next one is that they need to get feedback on will, feedback on skill, and feedback on metacognition. And I'm going to go through those in a few seconds because it's important to understand all these particular factors. So essentially, when we do any perform any task, we have a combination of will, which is motivation, skill, which is our knowledge and techniques for doing that particular performance, and we need to be able to control how we use motivation, knowledge, and techniques to achieve that task. And this is metacognition, which is commonly called thinking about thinking. And that is related to a wider concept called self-regulated learning. So if we look at when someone performs a task, such as doing a venipuncture, if somebody plays a piece of music, it doesn't matter what the task is, we begin to analyze the task. We start on that left-hand side. What do we need to do to achieve that task? What is the task? What are we expected to do? And they then begin to think, what particular motivation do I need to achieve that task? And what particular knowledge and techniques do I need to use? They then go through, they plan which particular motivational techniques they're going to do, what particular skill aspects, knowledge do I need, what particular techniques do I need to achieve it. They need to check whether what their choice is working as they're doing the procedure, and then they need to be able to adapt and make changes. So it's this constant cyclical cycle. If you want to read more about it, there's an Amy guide. You can search for it on the internet and it's downloadable, which myself and Tim Cleary did a few years ago on self-regulation theory, and it's got practical examples. So if we're going to understand the will, is the individual's self-efficacy beliefs. So self-efficacy beliefs is the individual's confidence in the extent to which they think that they're going to achieve that task or not. Because if they don't feel particularly confident, they are unlikely to achieve the task. So an important aspect is identifying the individual's confidence before they do a task. Because if they've got a low confidence, they need to be able to boost that by things like telling themselves, I've done this before, I know I can do it, I've been successful before, and these are the techniques. So it's this reinforcement that they are capable of doing it. And that's what Olympic athletes do. In the Olympic Games, you will see that before engaging in the task, these Olympic athletes tend to close their eyes just for a second. They get themselves into the zone and they go and do it. And that is really important. And they're telling themselves, I've done this before. They block out lots of noise which is around them. And by noise, I mean all the interruptions, as well as the physical noise. So they concentrate and focus on that task just for that, just whilst they're doing it. And they try and avoid being distracted, because we all know that if we get distracted, it's really, really difficult for us to do a task. Also, we need to understand their attributional beliefs, particularly if they are successful or unsuccessful. We know that learners who are highly successful, in sportsmen, musicians, anybody, have beliefs where they attribute the success and failure down to not having the most appropriate knowledge and techniques to achieve that particular task. They don't blame uncontrollable beliefs, such as it was just bad luck, it's not the right type of patient. And this is an important mindset. If you talk to Olympic athletes and you watch them on the TV, if they're talking about why they were successful or unsuccessful, they constantly talk about it wasn't just that it was sunny or it was rainy or it was windy. That's why I couldn't do it. It's because for some reason they hadn't got the most appropriate technique. And this mindset, a growth mindset, is really important for the future, because if they have this growth mindset, they are then willing to engage with feedback, because they then see the value of it, because they can actually control their performance. Also, whatever we do, we're required to have a certain amount of knowledge. And making a clinical diagnosis, performing a clinical skill, without having the basic knowledge, it is unlikely that they will be successful in achieving it. So we need to know whether if they were unsuccessful, did they have the most appropriate knowledge? And do they have particular techniques for doing it? So if you're going to be reading, say, a book and learning from a book or from an article, we have particular techniques of going about reading it. But we also have techniques for doing any procedure, for taking a sample of blood, for doing suturing, for making a diagnosis. So if we're going to do effective feedback, the most important thing is having a relationship with the learner. Because without that trusting relationship, similar to what we have with a patient, giving feedback is unlikely to be of value and to be effective. And establishing this relationship before we do an assessment and throughout the whole process of giving feedback is absolutely essential. And people have talked about having what's called the educational alliance. There needs to be a time and place when you do it. If you're going to be giving feedback, try and get somewhere where that person, it can be private. Because if you're going to be giving feedback in front of somebody else, and particularly if it's in front of a patient or other students or other junior doctors, they may be quite defensive and they're not going to be receptive because they don't want to appear to be foolish. So that's important. The place is important as well. There is some research to suggest that giving feedback immediately after a performance can be particularly beneficial for some people, but giving it slightly later after performance can be beneficial for other people. And that's quite difficult to judge. One way is to ask the learner of when they prefer to have the feedback. Usually it tends to be most effective immediately after the procedure. But if they were particularly upset by what they've done, because it wasn't successful, they're not going to be receptive to listening to what you have to say. So you may have to wait. The next one is signpost that feedback is being given. We've done research which has shown that students perceive that they're not getting feedback. Yet we've mapped in the curriculum exactly when they have been given feedback, and they have been given a lot of feedback. So saying to the student, I'm going to give you some feedback now. Students need to understand the value of feedback. And this is where it's about the growth set. It's not because you are a poor performer that you're unable to perform the task. It's the fact that you don't have the most appropriate techniques to be able to do that. So understanding that it's down to particular techniques that they're using, particular amounts of knowledge, the way that they coordinate this, their metacognition, or their will and their skill are vitally important. Also, it's been shown that, particularly in a medical context, that credibility is important. Because credibility, they want to feel that whoever is giving them feedback actually understands the level of performance. Also, as we said before, it needs to be supportive. Students, just like in a doctor-patient relationship, it needs to be given in a supportive way and throughout all the phases of giving feedback. So if we're going to be doing an assessment, it's important to be able to identify what is the learner doing well and not so well. Is it the task? What about motivation, the will? What about skill, the knowledge and the application of that knowledge? Is it about techniques? Is it about self-regulated learning? How they plan the task, analyze the task, how they plan, how they monitor, how they make adaptive changes. So how do we do this? The way that we do it is by asking questions before, during, and after engaging with the task. We can also make some observation as well about whether they're performing the task correctly. And it's possible to ask them questions. So, do you have a particular plan? And what is it? Are you on the right track? Do you need to make any changes? Because research suggests that there are big differences between high and low performers in the extent to which they plan, monitor, and adapt. And many students do not have a clear plan before they engage with a task, and they don't monitor. So if you ask students, do you think you're on the right track? And we've done research to show that if you give feedback to students only on these self-regulated learning strategies, that their performance actually improves. Again, if you want to read more about it, there's a 12 tips there on how to provide it, which provides detailed advice. And that was with Heather Leggett, who was my PhD student at the time. So once you've established a relationship and performed an assessment, you then want the individual to begin to change their behaviour. So the first thing to do is to be able to provide information. Did they get the task right or not? About their motivational aspect, their self-efficacy beliefs, about their skill. Did they have the most appropriate knowledge, most appropriate techniques? And you have to ask them these types of questions. And did they have the most appropriate metacognition or self-regulated learning about analysing the task, planning, monitoring, and making changes? And the big question is where are they on what's called the cycle of change? Because if they are going to be giving information, they may not actually be receptive to it. So are they in the pre-contemplative phase? In other words, they don't think there's a problem. Are they in the contemplative phase where they think that their performance isn't appropriate, or they don't have the most appropriate knowledge or techniques? Because ultimately, we want people to be in the action phase where they're going to do things differently next time. So it's absolutely crucial that we can identify where they are in the whether they are in the pre-contemplative phase or the contemplative phase. And the simplest to ask them is, how do you think you did? Which is a question which identifies the extent to which they are aware whether the test that they did was appropriate or not appropriate. Do you think you have the appropriate knowledge? Have used the appropriate technique to achieve it? These are the things that we need to be asking. Because if they say, I don't know, or, well, yes, I did, but they've got it wrong, or they don't know whether they've got it right or not, they think they've got it right, then in the pre-contemplative phase, they don't see there's a problem. But if they say, well, I don't think I did it quite as well, that means they're much more receptive. And the reason why this is important is because if they're in the contemplative phase, it's quite simple to just give them a little bit of information. But if they're in the pre-contemplative, you actually have to begin to sell it to them. And the way of doing that is building on dissatisfaction of the present, clear vision of the future, and information of the next steps. So to get people moving from pre-contemplative to contemplative, you have to say, well, although you said that you didn't do this well, actually, you thought you did this well. Actually, you didn't do it well. And this is the reason why. But if you did this in the future, so remember going back what learners want. They want to know whether they've got it right or not. They want to know how to not prevent it from happening again. And they want to know what they can do in the future. And this helps people to do that. Whereas if it's in the contemplative phase, it's much easier because you can just give them some information, they're likely to accept it. So I hope you found this useful, because ultimately is how can you put what I've discussed into practice. I suspect many colleagues will not be aware of all these various factors. And if we're not aware of them, we don't put them into action, which is unlikely that we will get the maximum benefit from feedback. And as I said, research shows that 17% of feedback studies show that feedback is ineffective. And the reason why it's ineffective is that it is not given in the most effective way. When we give it in an effective way, when we give feedback specifically related to task, will, skill, and the metacognition, we can expect to get maximum benefit from giving feedback. Some of this is going to be different to what you've done before. I suspect many colleagues give feedback related to knowledge and also give feedback related to techniques. This is what most people do. And usually we give feedback related to whether they've got it correct or they haven't. Although sometimes we don't do that. As I've said before, I've seen many learners who have said following feedback, well, did I get it right or not? So that's really important. The less familiar areas are likely to be feedback related to self-efficacy beliefs. How confident assured do you feel that you can do this task? That's all you have to ask before they do it. If they've got low confidence, you can be then saying afterwards to them, well, you seem to have low confidence in doing this task. So how did you try and overcome that? And give us some advice about this self-talk. Same as our attributional beliefs. The reason why I got it wrong is because it's a wrong type of patient. It's artificial simulation. Well, experts will do it in artificial simulation, and if it's noisy. So it's about having the most appropriate technique. So it's about challenging their attributional beliefs. If it's about self-regulated learning or metacognition, I suspect that many colleagues do not give feedback related to this, yet it is absolutely crucially important. And it's quite simple. It takes less than 5 minutes in our experience to give this type of feedback. All you have to do is to ask them questions before, during, and after a procedure. Do you have a particular plan? Do you think we're on the right track or not? And have you made any changes? But it's absolutely crucial that they are able to plan and set themselves very clear goals, what we're going to do, and that they're aware of the extent. The way that they develop that awareness is quite simple. It's just people need to check as they're doing it, whether they're on the right track or not. And that is a particular technique that they can learn. So I hope you found it useful. I wish you well in your journey of using feedback. And if you'd like to ask any questions, I'd be delighted to answer them. And I'm not sure how easy it is going to be in this setting, but I'd be delighted to talk to you if need be. Thank you.
Usually poor internet connection, John. But Suchita has raised her hand. Suchita, you know, she's from the Iras University, Lucknow. Hello, Suchita, go ahead, please.
So nice to hear you, John. Always a pleasure. My main concern is, as you rightly said, how do we make our students respond? It's there in place, but sometimes they're not as caring as we would want them to be. And I'm sure quite a few of us as teachers have felt a little disheartened when we, put in if not 100%, 90%, and they don't even come up ahead to sort of do their bit. And that's what then, especially the younger faculty then feels that what is the point? I tried, and well, it's just not working. So I mean, it's a comment, but yes, thank you.
Thank you. Thanks very much, Suchita. Nice to see you again. If we're talking about giving feedback, I think the biggest barrier is that the learner needs to feel, first of all, that it's in a context where feedback is not punitive and it's part of the learning process. It's a bit like patient safety, is that if you feel threatened, if you feel that making a mistake is not, it's going to have major adverse consequences. I mean, think about as any of us who make a mistake, or we haven't done as well as we thought we would. We're going to be defensive. We're going to be frightened that somebody's going to shout at us, be annoyed at us. We're worried about what the consequences are of not doing well. And I think this is where we need, first of all, for students to understand that all of us do not know everything. I don't know everything. You don't know everything. Nobody in this room knows everything. And even as experienced doctors, as experienced educators, we will have areas which we don't know. If we recognize that we don't know something, we can then rectify that by reading about it, doing more practice, talking to others. So if we don't know something, it's part of growing. And Carol Dweck is an educational psychologist. She talks about the developing a growth mindset. And this is so, so important that students can develop a growth mindset so that if they don't know something, but also it's important that they don't feel threatened about if they don't know something, that they're going to be ridiculed, particularly in another group of students, they're not going to be put down. It's also recognizing that, okay, they may not have performed on that occasion to the required standard, but they have lots of strengths, that they've done it before. How have they been successful before? And that it's not a reflection of them as an individual, it's a reflection of them not using the appropriate approaches to learning, that they don't motivate themselves adequately before doing things, that their attributional beliefs are inappropriate, that they don't that they haven't got the right amount of knowledge, that they're not using the most appropriate techniques, that they're not analysing the task, that they're not planning, that they're not tracking, they're not making changes as they're doing the procedure. So that is all trainable. That is all they can learn, they can develop. And that's what's absolutely crucial.
True.
So hopefully, it's creating this culture that feedback is important, yes, just like patient safety.
Thank you. So true. So true.
I have a question, John. How do you overcome the problem of hierarchy, which is a major issue in all the developing countries? I mean, for example, in the UK, it's customary to call a professor by first name. Like I call you John, and I call Ronnie Harden Ron, and Robin Blair Robin, and so forth. But you can't do that in these cultures. In Asian cultures, a professor is like a father, even more respected than a father. So the hierarchy continues to prevail, and that prevents feedbacks and portfolios for the reasons that Suchita said, that there's a fear that, it will be abused or whatever. How do you overcome that issue?
I mean, when I was a student years ago, we still had that issue, that when I was a student, we had even Professor Sir Charles Stuart Harris was a professor of medicine in Sheffield when I was a student. But he was actually
Professor Sir Knight double barrels. The names
double barrel, Professor Sir and Professor Sir Charles Stuart Harris. And but having said that, he was actually very approachable. He spoke to you in first name.
Yeah.
And he
you see, we unnecessarily blame Flexner. We should blame the British for giving us this culture in the Eastern nations.
Yes, I think it's about just recognizing, it's how you present yourself to them. I mean, I've had PhD students who still call me professor, and in fact, one of my children's best friends, even though he's in his 40s now, my son's best friend, one of my son's best friends, Matt, he still calls my wife Mrs. Sanders. He doesn't call her Anne. It's bizarre. He calls me John, but it's a sign of respect.
Yeah. Of course. So these are cultural issues. So coming back to the topic, now we have this audit system in the UK, the GMC, and we have to do appraisals every year. In fact, I'm due for my appraisal, going through the process right now. Now, is that a good way of developing portfolios, feedback? Like one of the columns in that appraisal thing is the tasks that you established last year. Have you met them or not? And if not, then we discuss how to improve. That kind of thing, would you recommend?
Yeah. People play the game. I mean, the big difficulty with the UK appraisal system, the big problem with the UK appraisal system is that it's very mechanistic. I think you can be very superficial, but for reflective practice, you actually, it's counterproductive. And in fact, I wrote with one of my colleagues, a hospital consultant, when I was in Sheffield, and who was dean of the medical school, Deborah Murder Keaton, and it's in Archives of Disease in Children. We called it about, it becomes a ritual reflection in the mandatory portfolio in the UK and the appraisal system. So people tend to use examples which are relatively superficial. People don't discuss it. There's all sorts of reasons. And I think people don't want to disclose information to others. I think the way it is not the ideal system in the UK. But it's at two levels. It's meant to stimulate professional reflection, but also give a degree of managerial control over the doctor as well. And I think the managerial idea of setting yourself objectives and to the extent you've done that and what the barriers were, I think, it's part of the management culture. We're not going to be able to get away from it. And I think it tends to be often quite superficial. I think when it becomes reflection, that it needs to be a different system. And I would recommend having a separate system, much more like educational supervision that you get in other professions, where the system, there's a managerial control system, and there's also a much more developmental system.
Yes.
Okay.
Thank you so much, Professor Zaidi. And if there is no question, we can, Professor Sadun.
Dr. Ali Mansoor, do you have a question? Ali Mansoor?
Yes, sir.
Yes, sir.
Dr. Ali Mansoor is there, sir.
Yeah, I wanted to say something, Mubashir here.
Go ahead. Go ahead.
Thank you so much for an excellent talk, sir. I think when we develop any syllabus, we say what is learning objective, what is learning outcome. Similarly, we should say what is feedback mechanism here. That's the most fundamental thing, because the learning should be micro learning, because of change in the habits and the behaviors and the systems. And systems should churn out feedback as compulsory as they are submitting anything else. Like when they are submitting it, the feedback must come along with it as a compulsory mechanism. And universities especially should pay attention to the data, that feedback has a certain specific standards, and every of that feedback is plotted and charted and mapped, and outcome should be explained. And I think that's the fundamental change it must come.
Thank you, Dr. Mubashir.
Yeah, I would totally agree with you. I think the educational triangle of aims, methods, and assessment is crucial. And for me, any assessment, feedback is an essential part of it. Even summative assessment, people need to get some degree of feedback. I think it depends on the extent of feedback that you can give it in the summative exam. But I think I totally agree with you. Feedback is assessment for me. It's part of that cycle. Whenever you do an assessment, you should always give feedback, absolutely. Because otherwise the learner can never, ever begin to calibrate their performance for lifelong learning. The only stimulus to lifelong learning is recognizing that calibration is the extent to which we believe that our performance is correct against the reality of whether it is correct or not. And unless we have calibration, we will never, ever have lifelong learning, because you always think that you're actually doing well.
Thank you, sir. Thank you.
Thank you. Dr. Ali Mansoor want to ask the question. Dr. Ali Mansoor.
Thank you very much, Sir Sanders. I have just two comments. First is the step of monitoring of the shift of the track. I think we need to not just to monitor, we need to measure to how extent we shifted from the track, because the action will be parallel and corresponding to that shift. The second comment is that there is an issue of bias or compounding from the data collected by some audience targeted by the feedback. So how can we manage these things? Thank you very much.
The only way that we can measure performance is having measures during the performance. We've done work, I've got a PhD student at the moment, and there's a big literature on this, that using electronic systems, as people are doing tasks, you can collect this sort of micro performance data. Some of this is about getting prompts and asking questions as they're doing a procedure. So the more information you get, the greater that you can begin to understand it. And we've done work on clinical decision making. And if you look at it in Google Scholar, you can see this. So if you want to give people really fine-tuned, accurate, you are giving them a measuring performance, not just at the end of doing a task, but constantly during that process. Now, microanalysis is the nearest you're going to get to that, where you are asking specific questions throughout the whole process of engaging with a task. And if you want to get used to it, as I say, the 12 tips guide is really, really useful. That one by Leggett, Sanders, and Roberts. You should be able to get it off the internet. If you search on Google Scholar, you can download it. And that has got it's quite detailed on how to actually do that. And it's also got the references to some of the research. So if you look at what has been quoted, where it's been cited, you will see the work that I've been particularly involved with and with colleagues is about this very much finer grained questioning called micro-analysis. So these are asking targeted questions during the performance of a test. Usually, we only measure something at the end of doing a test. Did I get it right or not? We need to measure all of the processes, not just the task, but also their will, their skill, and the metacognition as they're doing this. And you can do it electronically by giving people problem-solving tasks. You can do it with performance tasks. Okay, they're artificial at the moment, but with simulation you can do it. The equivalent of surgical procedures. There's no reason why you can't do it with that. As far as I know, people haven't done it with surgical procedures, but we've done it with clinical decision making. And I've got a PhD student doing it at the moment. And he's not the only person that's done work on this. So if you look it up, you can see how to do it. There's a guy called Azevedo, there's Winnie from Canada, Azevedo from Florida, that they've constructed systems, electronic systems, which look at problem solving, which give a much finer grained feedback. Because the finer the grained feedback you can give during a task, the more effective the feedback is. You need to have all the components, but you also need to be able to identify all these components. And that's where the difficulty comes. For all of us, if we're not used to giving feedback like this, it requires development. It's possible to easily develop these skills, honestly. It takes less than 5 minutes to do it. The more you read about it, the more you see it's easy. We've done work with physiotherapy, we've done work with ventilation, and it's published. It's in Medical Press today. Are there any more questions?
So, John, I'll send you the link for tomorrow's lecture. We'll have the same time, and the topic is curriculum development, as you
Yes, that's right.
give. So tomorrow, same time, but I'll send you, probably it'll be the same link, we'll just update it.
Okay then. Now I've met all of you. Thank you very much. Bye then.
Thank you.
Thank you. Over to Dr. Bukhari and Dean to close the
Bye-bye.
session.
Thank you.
Thank you. Thanks,
Thank
nice to meet
you.
everyone.
Thank you.
Bye.
Bye. Thank you so much.
Thank you.
Professor.
Bye.
Bye.